everybody. My name is Swathi Balantrapu. I'm a lead researcher at Stanford School of Medicine and Department of Veteran Affairs in Palo Alto. I'm a physical therapist by profession, and I have extensive background and experience working with older adults. Early in my career, I was interested in researching multiple sclerosis and how physical activity affects MS. I published several articles and involved in multiple projects. Currently, I'm the CEO and founder of AgeWiser.ai, which is a senior care application to prevent falls and improve overall wellness in aging adults. So today we have the pleasure of meeting Dr. Carole Lewis in our interview. Dr. Carole Lewis is a distinguished figure in the field of geriatric rehabilitation. She has made significant contributions through her publications, leadership roles, and as a clinical practitioner. Dr. Lewis has held prestigious positions such as the president of the Academy of Geriatric Physical Therapy. She's also known for her educational initiatives, including founding great seminars and books which aim to provide high-quality continuing education for healthcare professionals focusing on older adults. So without any further ado, let's welcome Dr. Lewis.
Thank you. Thank you. Yes, good to be with you.
Well, thank you for your time again. I'm very thrilled to engage in this interview with you and learn, from the wealth of knowledge and experience that you have, Dr. Lewis. So to quickly dive into our first question in the interview, could you please share some insights on the current fall prevention landscape? Like what initiatives do we have in place within the healthcare industry?
Okay. So you asked about sort of, what's going on and what's the landscape. And I think people don't understand how big the problem really is. Pretty much, if you're 65 years old, you have a 1 in 4 or 1 in 3 chance of having a fall. All right. So that's a pretty high percentage. And the reason it varies from 28 to 35% is depends where you are. So for example, if you're in the community, it's a little lower. If you're in an assisted living facility, probably a little higher. And then what you have to recognize is as our population ages, which it is doing, more people will be at risk for falling. So the problem is not going to get better, it's going to get worse. And the thing that people don't understand is that falls really adversely affect health and lead to disability and mortality. It's not like, oh, you fell, you get up, little kids fall all the time. But when an adult falls and an older adult falls, it can be a serious problem. Things like, you can get fractures anywhere, hip being the worst. And then you can have a head injury, which is also pretty terrible. They're costly and they continue to decrease, not just in the United States, but all over the world. I think people don't understand that even a non-injury fall is associated with negative impacts. What I see in a lot of my patients is, okay, they fell and they didn't hurt anything, but now they walk like they never want to fall again, which is not the way to do it, because then you have this really unstable gait that's very dependent on touching things or using a walker, and that's not the best thing for working with falls. So that's just a little bit of background that I thought might be a good idea to kind of share.
Yeah, I 100% agree with everything that you said, Dr. Lewis, because falls are a major problem. And like you said, even if, they did not break their hip, or even if they did not injure, it can lead to negative consequences like slowing down and not doing physical activity because they're
Right,
always
and not doing things they want to do.
Yeah.
I'm not going to do that because I'm going to fall. What kind of life is that?
Yep. So true, so true. So next question leads into like how technology can help transform care for the elderly. So Dr. Lewis, can you share some insights on innovative technologies and how they empower seniors to maintain independence.
Great question. I would love to elaborate on how AgeWiser can really help therapists in rehabilitation. So, here are my thoughts. We're asked to do so much, and oftentimes we're not really given the time to do what we really need to do. We know the importance of the 5M, but do we really have the time to constantly monitor medication and mentation, and really supply that kind of piece to the therapeutic puzzle? So while we're working with the patient, we can use AgeWiser to manage those pieces, and and also supplement what we're doing. There's nothing better than a video exercise, and it has so many in the app that we can give to our patients. They can look at their phone, they can do the exercises, which is great. And then the other thing is, we are one of the few professions that discharge our patients. I think we should never do that. And I think AgeWiser helps us keep our patients. Once we discharge them, we give them the program, their exercises are on there. We're dealing with all the areas of the 5 M's, and we are really keeping our patients on a program that they can use for the rest of their life. And then if they have any problems, they come back to us. We're never really discharging them. And I think, to have something to help us do all the things that we want to do with our patients is incredibly important. And especially now when we're being crunched for time, and we're being asked to do so much. And on the other end, we know how important what we do is, and the rest of the world and medicine is realizing how important what we do is. And if we do a crummy job, that's going to be problematic. So this helps us, do the best we can with what we have, and it helps us expand to be as good as we can be. So that's what I really like about it. It's a great way to use in the rehabilitation process and after.
All right, Dr. Lewis, the next question for you. So, what do you think are the current challenges and advancement in terms of fall prevention?
Definitely. So I'd like to actually go back a little bit. I think that would help.
Mhm.
And because I think what you're doing is you've taken the evidence, and the evidence has been starting to come out, early 2000s. And so around 2012, they put a committee together that looked at everything we could do for prevention of falls in community dwelling older adults. And what they found is what was most effective was physical therapy or exercise and vitamin D. The only thing they found was exercise or physical therapy. So this one, by Usi Rossi. So what this is, so what that was is a review of everything with experts saying this is the best. But what I
Mhm.
really like are what are called randomized controlled studies, where you have one group that gets nothing, one group in this study that got vitamin D, one group that got exercise and vitamin D, and one group that got just exercise. And what they
Mhm.
found, if you want to click the button, is that physical therapy helped, but vitamin D didn't. And so, what we're realizing is exercise is one of the most effective components. I mean, there are others and things that I know you cover in your app, which are really important, like mentation and medication and, the social support. Those are all important, but the exercise piece is really, really important. So, if you can show me the next slide, this one is a really new study. So now I took you from 2012 all the way up to 2024, and this is a risk assessment and prevention of falls. So this is sort of, 2024. Here's where we are, state of the art. Basically, again, more than a quarter of older adults fall every year, and the leading cause for people over 65 is, with this, it's a leading cause leading cause of injury related deaths in people over the age of 65. And basically, what they're saying is exercises to improve strength and balance are really recommended for people who are at average to high risk. And pretty much the consensus is saying if you're over 65, you got to be doing something. All right. And so I think the challenge is, and I can't say it any better than this, I am on the medical faculty. I help at GW, and I teach and work with the fellows in geriatrics. And I talked to one of the main physicians, geriatrician, about some studies that were going on, and we were chatting. And she said, basically, the best thing that you can do, this is a geriatrician, is to not get into the medical system, to do all you can preventatively to stay out of it. And so something like what you've created with this app is doing exactly that. Because how do you stay out of the medical system? And what it is not one thing, it's really putting it all together individually for yourself. So I think the challenge is the medical system. I hate to say it, is having trouble putting together all these disparate entities. If you have a problem with your lungs, you go to a pulmonologist. If you have a problem with your heart, you go to a cardiologist. If you have, so how do you get something that pulls it all together? I think that is the real challenge. And I think you may not be able to turn to the medical system to get the answers. You need to look to alternatives to get the answers and to take care of yourself so you don't have the problems. And that's, I think, what's really important. You agree?
100%, Dr. Lewis. I love when you said that exercise is the medicine and not the hospitals or the doctors that can do anything when you cannot have that physical activity going, when you don't have that exercise. Exercise is like the key to keep the organs and everything functioning right.
Yep,
So
yep.
thank you, Dr. Lewis, for that answer. The next question coming up is, what are some of the gaps that we have in the current solution that AgeWiser.ai aims to fill in?
Yeah. So I think what AgeWiser does is pull all the different pieces together. And I think that's what's important. I'm a huge fan of exercise, but exercise isn't enough. All right. And as a physical therapist, I don't really have the time to work on cognition and to see if my patients are doing enough to stimulate their cognition, or I can't really be, the person that coordinates their social support. So I think your app provides all the other areas that are really important for falls prevention.
You and I agree. As therapists, we have very limited time and limited resources as to how much we can, offer to our patients, and we want to give the best, results to them, and we want to, make this more comprehensive. So something that we as therapists could do is, motivate these patients to start using an app like AgeWiser that has the comprehensive model to attack each problem in different ways. Yeah. Okay. Awesome. So next thing is, which leads to our next question on how technology can transform care for the elderly.
Well, first of all, I do think it's a group that's not going, they're not like my kids, they're millennials. They were brought up with technology. I do think that older people are re- they're not they're not masters of it, many of them. But I think if they recognize how important it is and how they really need to use technology in their life and how it can help them, I think it will be a wonderful, um, not just an adjunct, but a real centerpiece of their healthcare. And I know a lot of people are hesitant and they're not used to maybe going on their phones all the time or on a computer. With that said, I have a lot of patients that are very techno savvy, but I do think a lot of people are hesitant, but I think they shouldn't be, because I think it has so much to offer that, you can use that to coordinate so much of your healthcare. And I think AgeWiser does a great job of pulling all those pieces together, individualizing it. That's what's so really cool about it, that one person's program is not at all the same as somebody else's. And what you do every day is very different than what somebody else might do. And I don't know of many areas of medicine that do that for you, or anything. It's social sciences. So it's incredibly innovative that way.
Thank you. Thank you. Moving forward, we have the AgeWiser app and what the key features of the app itself. So the app is designed based on the 4M's framework, where the key concept is to apply these 4 M's to optimize the health of an older adult. So the very first M that we have is called mobility. So to improve someone's mobility, we have included about 180 plus videos to help someone's balance, strength, endurance, and flexibility. The next M that we have is medication. So in medication, the clients automatically get these reminders or alerts to take their pills on time. Also get alerts on if there is any drug to drug interaction, or if there is any severe overdosage in any of the drugs, because sometimes the medications that they get from one physician is also is also given by a different physician or different doctor, like a specialist. And sometimes when that's not communicated amongst the doctors, the patients are getting twice the dosage of the same drug but in different names probably, and that can cause potential overdose. So all of these alerts that they get is not only to the patients, but the caregivers get the alerts, whoever is the responsible party for the older adult health. Next, we have mind. So this M, mind, we have about 5 or 6 games so far that we designed to enhance somebody's cognitive function and help maintain their mental acuity as they're playing these games. The last M, what matters most. What matters most, we have included the social connectivity piece here, where we have an artificial intelligence powered caregiver called Jen to help improve their isolation, loneliness, and provide some kind of a companionship. And the Jen will have a very meaningful contextual conversations tailored to the individual, ensuring that the older adult is feeling supported and engaged throughout the conversation. And these key features collectively aim to improve the independence and quality of life, enabling them to age safely in their own homes. And the next key feature that we have is the fall detection and fall prevention. So the app itself utilizes sensors and machine learning algorithms to detect falls in real time and also alert their caregivers immediately, so that there's no lag in the response time, thus preventing any complications that may arise from delaying. Okay, and then the other hero feature that we have, and this is one of a kind so far in the app world for seniors, is the vital management. So in the vitals, the patients can actually measure all of their vital signs without having to connect to any hardware piece. For example, they can just directly look at the camera of their phone and measure their heart rate, their blood pressure, their pulse oxygen, and their respiratory rate. All of these just within a span of 1 minute. All they have to do is put the camera in front of them, and they can immediately measure. All those vitals are recorded on your health, or some kind of a health app where there is a nice tracking system, and the AI is constantly learning all of this to make sure that everybody, not only the patient or the client, but everybody on the team is alerted if something is abnormal or not falling in the normal range. All right, Dr. Lewis, the next question is for you. So, how do you think AgeWiser.ai sets apart from the other solutions we have in the market?
Well, I think there's really nothing like it, so it's easy. I don't know of anything that's out there that does this, so I think it provides so for me, I think one of the things we haven't talked about is the American Geriatric Society has come up with in the last several years what they call the 5 M's, and feel for older persons, you really need to deal with the 5 M's. And I think AgeWiser does it perfectly. So, what are those 5 M's? You have mentation. So, you need to check and make sure your brain's okay. Everybody thinks they're fine, but it wouldn't be nice to know if you're having some issues. And sometimes they're caused by depression. Sometimes they're caused by what's called mild cognitive impairment, which isn't dementia. Sometimes it could be dementia. But one of the things for sure is getting a baseline, incredibly important. AgeWiser does that. All right. I don't know if many of you go to the doctor and they actually take the time to give you a validated test, but AgeWiser does that. Um, and a lot of those mental issues can actually get better by cognitive stimulation, which AgeWiser has, by exercise, which AgeWiser has. So they're not just looking at your problem, they're actually giving you some answers. So that's one. Secondly, you have medical complexity, which is one of the second M's. And AgeWiser puts together, all your medical issues so that where you have deficits. They measure various aspects of your function. Thirdly, they look at medication and they do a fabulous job with medication because, it's hard to manage medications, and medications aren't just, your simvastatin, for example. It's also, what if you're taking turmeric for arthritis pain? A lot of people take alternative medications. You can put those in the app as well. And what's wonderful is it does something that all your medical professionals should be doing, but I know are not. Some things don't do well with each other. And I said turmeric, there's a lot of medications that you can't take with turmeric. So you need to have, and of course, there's a lot of medications. For example, some of the blood thinners, you can't be taking ibuprofen. And if you are, that's a big problem, but people don't know that. So once you put your medications in, you'll get that message, which is invaluable. So you have mentation, multiple morbidities, you have medication, you have mobility. All right. How important is it to stay mobile? Incredibly important. So, you know, AgeWiser measures that by various tests like gait speed. And then it gives you things to do. 100, what did you say, 80 exercises? I knew there were close to like 200.
180 plus. Yeah.
Okay, 180
200.
plus
Yeah.
exercises. And then the final one is matters most. And to me, I think it's the one that matters the most, which is what is most important to you. And so here's an app that integrates all of this so that you can work on what is most important for you. And for me, why I want to stay healthy is because I feel better. I can do all the things that I want to do. And so, knowing that if I play some mental games in the morning, I'll keep my brain stimulated. If I do some exercises for my strength, I won't fall. These are great things to have in a program that I can do every day. So those are some really wonderful things that your app provides.
Thank you, Dr. Lewis, for those wonderful comments that you just provided on how AgeWiser sets itself apart from the other solutions we have in the market. And I really applaud you bringing up this wonderful point, saying it addresses both mental and physical health at the same time. That's a great point. Thank you. So furthermore, I would like to discuss the future developments or the future projects that AgeWiser is actively and tirelessly working on. Is the hardware piece of equipment, again, to prevent falls. So this is an equipment that we are working on to detect how a fall happened in the first place. So this information can be given to your rehab specialist, like a fall prevention physical therapy expert, where they can exactly know how it happened, what time it happened, what terrain, where the person is standing. So very critical information. So, they can prevent a second fall from happening soon, if it's in the home and if they're constantly walking on a certain terrain, and if that is causing them to slow down, or, some of the gait patterns changing, all of that is detected, and, we can take action before a fall can happen. So that equipment is coming out in November or December of 2024. And the second key development that we are working on is the translation of the app in multiple languages, because we envision AgeWiser going global and having access of the app to seniors all around the world to improve their overall wellness and aging in place. Um, Lastly, we are also working on developing exercises for very specific conditions like arthritis. Somebody has a knee replacement, a hip replacement, or somebody has back pain. Again, these are not intended to replace professional advice or to replace rehab specialists or doctors, but it's just to supplement what your doctors or rehab team asks you to do. Okay, next I'd like to invite Dr. Lewis to share her personal views on how AgeWiser.ai is improving aging in place.
So I think what older people want, most older people, they want to be able to live where they want to live. I mean, it's so bad. I actually, when I teach, I videotape my kids when they were 3 and 4, and I had them say, "Mom, I'll never put you in a nursing home." And then my young son goes, "I might." It's a joke, but I did it because most people don't really want to end up in a nursing home. So the whole thing that you're talking about, aging in place, is very important, which means you get to live where you want to live. Well, you're not going to be able to do that if you're weak, if you're confused, if you need somebody to take care of you. So what the nice thing about the AgeWiser app is it puts together all the pieces that will help you stay independent and stay where you want to live. So that's, I think, incredibly important. I mean, people talk about aging in place. They don't get a house with 7 sets of stairs, which isn't necessarily true. I mean, I've had patients in their 90s that have, I had one lady that had an art studio in the basement, and then she had her artwork on the 4th floor. So every day she'd go up and down the stairs. She was in great shape. So it's not necessarily that you have to get an environment that does that. What you have to do is be in good enough shape to live where you want to live. And that's not just physical, it's mental, it's having the social support. And again, AgeWiser has those components for you.
As we wrap up our discussion today, I would like to take a moment to express sincere gratitude to Dr. Carole Lewis. Dr. Lewis, thank you very much for those insightful comments that not only enlightened us, but also underscore the crucial role the technology plays in enhancing the lives of older adults. To all the viewers that is watching this video, please go into your app stores, download the app, AgeWiser, AGEWISER. Let's save lives. Let's prevent falls. Join us in embracing a future where technology enhances aging in place. Thanks for watching.